So then you had to do an outpatient kind of sub-internship or outpatient rotation, I guess is what I would say. And I did that with a private practice family doctor.
Okay.
And that, I would say, was really the formative experience for me in all of medical school. Because I go out to this clinic, and I worked with him for 2 weeks, and then he took 2 weeks off on vacation.
Okay.
And I kept going to the clinic every day, and they had patients scheduled every day.
As the main doctor?
It was me and his nurse practitioner. It was the two of us taking care of a regular patient panel.
Okay.
Right, that was coming in. And that's the kind of thing, I don't know if that would take place today. I don't.
Right.
It was the end. He was I think he was at that point already. He was kind of toward the end of his career. I think he represented the end of an era.
Not so afraid of losing a license.
Yes. So he let this fourth-year medical student.
Did anything go wrong during the
Not that I'm aware
time?
of. No, actually, but that was the thing, right? So I understood that responsibility, right? I was like, these people are coming in here.
Rare opportunity, honestly, for a student in your position.
My doctor is gone. He's gone. And this was, but we didn't have email. There was email, right? But we weren't emailing back and forth. Like we didn't have the ready contact. I forget where I think he went out of the country, if I recall correctly.
Oh, wow.
Right?
Okay.
So whether he was checking back in the background to see, I don't know if he may have been doing that, right? But in terms of our direct communication, we weren't communicating. So it was just me, and then his nurse practitioner would see her patients, right? And we would talk about them every day and try to review them. So it was being given responsibility, right? And with that responsibility came, I think it went back to that original motivation, right? I got into this to try to learn a skill to help people.
Right.
Well, now here I am in a practical situation where these people are coming to me expecting answers.
Yeah.
What am I going to do, right? I have to know something. So that motivated a lot of, all right, I got to read. I got to look at what cases are coming in and try to learn something before I go in. And then after I talk to them and learn more, I got to go read some more about this, right? And try to educate myself and figure out what to do about these cases.
Yeah.
And that again was a very positive motivation. The positive motivation was trying to help people with a real problem. It didn't have anything, I wasn't getting a test on it. There was no grade assigned at the end of it or whatever the case was.
Right.
This was just, people need help. What are you going to do?
Yeah.
Now you know at least enough to know where to look to find the answer.
Right.
Right. Even if you don't know the answer, what are you going to do?
Right. Was there a difference in that scenario also because of it being a outpatient clinic rather than an in-hospital setting?
I mean, the main difference was the different types of problems. Right?
Yeah.
Different types. But occasionally people would come into the outpatient clinic with an inpatient problem. Right?
Okay.
They would come in and they'd be
referring
really sick, and we'd have to, order some tests and figure out what to do. And then in some cases you send them to the hospital if you don't have the capability to handle it in the office. So it was different levels of severity and just different types of problems.
Right.
But I think the main difference was really the work environment. It was the people I was working with. And again, that autonomy and that responsibility of, we expect you to handle this.
Right.
Right.
Did that did you have a question for yourself prior to that setting of whether you really could handle it? I mean, it sounds like there was a lot of the fear mongering and a lot of that, shaming of not knowing things that you maybe shouldn't know yet even. But to this point, now you're in the last year of medical school. Was that kind of a reassurance of this is the right piece for you?
I didn't, even during the roughest times, I would say I didn't necessarily feel like that it was something I could not do.
Yeah.
I did feel like this is a thing I do not like.
Right. Yeah.
I don't know how to describe it. It would be like, just think about anything in your life where you have the ability to do it, but you do not enjoy the thing itself. You don't enjoy that activity. You don't enjoy the process of gaining the skill at it, right?
It's like getting good at running or something like that.
That's probably
for some of us.
Yeah,
where there's that one where it's I can do it. I don't enjoy it.
Not at all.
But you found some enjoyment in that piece?
Yeah. I would say for the first time, that's probably the best way to describe it. I actually found some joy in the work.
Nice.
For the very first time ever.
Wow.
Because previously it was just a miserable slog through one requirement after another, one sort of competitive environment after another.